Hello and welcome to KCS Connects. I'm Jack Miller, one of the co-directors of Key Clinical Skills. And KCS Connects is our way of helping you to stay connected to some of the literature out there that we believe will positively impact on your clinical practice. Now, this particular issue of KCS Connects discusses a topic that I'm actually quite interested in, and that is advanced practice physiotherapy for adults with spine pain. And it's a systematic review with meta-analysis. And the research was conducted by a group of researchers from the University of Montreal, and it was published in the European Spine Journal in 2021. Now, just to give us a little bit of background here, World Physiotherapy recently conducted a cross-sectional survey of its member organizations. And what came back is that 14 member organizations at that time had formalized advanced practice physiotherapy rules, including Canada. And the most commonly used term in that survey was advanced physiotherapy practitioner, and that's the term that we'll use. One of the reasons that we'll be using that term is this is another study that was done in 2018. It's a survey of the Canadian provincial regulators by the Canadian Alliance of Physiotherapy Regulators. And at that time, there was no broadly agreed upon definition of the term of advanced practice, lots of confusion, overlap, and often conflict with terms like specialization, extended practice, and advanced practice all being used interchangeably. And that's why, again, we'll be using the term physiotherapy practitioner. Now, physiotherapy practitioners are now well established, right from Vancouver through to Halifax and virtually all major Canadian provinces. And I'm sure we'll be seeing other provinces joining this group as well shortly. Now, this particular study was, again, a systematic review and meta-analysis, and they looked at 18 different studies with over 9,000 subjects. And they looked at a group of these studies, including 2 randomized controlled trial studies. And the vast majority of the patients had pure spine disorders, mean age 54 years old. Gender distribution was quite variable between 39 up to 66%, depending on the studies. And the study countries included Canada, Ireland, United Kingdom, Australia, and Sweden. Now, what they came back with is that physiotherapy practitioners were able to provide comparable outcomes to medical practitioners for pain, disability, quality of life, and patient satisfaction. At the same time, they were able to lower specialist wait times and independently manage almost 90% of patients compared to medical practitioners. Now, another cross-sectional study done in Quebec, looking at patient satisfaction and confidence. This is a survey of the public. And what they found there is that the confidence in medical act delegation to physiotherapy practitioners was overwhelmingly positive. And the public found the concept of physiotherapy practitioners as a favorable phenomenon. Now, if you'd like to learn more about this particular study, please come visit us at www.keyclinicskills.ca. And you can get a review of this particular paper, the full review of it, and gain free access to all of our library of different research reviews as well. And if you're interested in the role of advanced physiotherapy practitioners, come and visit us at www.keyclinicskills, and you may be interested in our advanced physio practitioner online training program. Thanks for your time.